If your legs feel heavy or unreliable when you walk or stand, it's easy to assume that it's aging, muscle loss, or something serious or irreversible. But in most cases, legs don't fail because they're weak. They shut down because the nerves can't tolerate the load the way they used to. That's why generic stretching, posture correction, or pushing through pain often makes symptoms worse instead of better. In this video, I'll explain why your legs feel heavy or unreliable when walking and standing, and what that sensation usually means at the nerve level, not the muscle level. And stay until the end because I'll show you two specific exercises we use every day to help people whose legs are heavy, weak, or unreliable. One calms irritated nerves, the other quietly restores walking and standing tolerance, but only when it's used in the right way. Keep watching. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, pinched nerves, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. You may notice that you can't walk as far as you used to. You stop to rest more often, even though your legs may feel fine when you're sitting. That contrast can be confusing. Some days feel manageable. Other days, your legs feel almost unreliable almost right away. It's easy to assume this means your legs are wearing out or getting weaker over time. But when symptoms change depending on whether you're walking, sitting, or standing, strength usually isn't the main issue. More often, the nerves that supply your legs are being stressed when you're upright and moving. That's why the pattern matters. Walking and standing tend to bring symptoms on. Sitting down, bending forward, or leaning often brings relief. Once you recognize that pattern, it points us towards the source of the problem. One of the most common reasons nerves become stressed that way is lumbar spinal stenosis. Understanding how that condition affects the nerves helps explain why your legs feel the way they do. In simple terms, lumbar stenosis means the space around the nerves in the lower back becomes more crowded. Over time, that crowding doesn't usually cause constant pain. Instead, it limits how much stress the nerves can tolerate when you're upright and moving. When you stand or walk, the lower spine naturally arches slightly. In someone with stenosis, that position narrows the space around the nerves even more. As the nerves become more stressed, the nervous system responds by reducing the signals going to the legs. That's why when people feel heaviness, weakness, fatigue, or the sense that their legs might give out, it's not that their legs suddenly lost strength. The nervous system is cutting back signals to protect the nerves from getting more irritated, kind of like turning down the volume when something is way too loud. This also explains why they behave the way they do. Walking and standing bring on symptoms because they increase nerve stress. Sitting down, bending forward, or leaning on something opens up space and reduces that stress, so symptoms ease. That change can happen quickly, which is why people are often confused by how fast their legs can feel better once they start sitting. The important thing to understand is that lumbar stenosis does not automatically mean surgery, and it does not mean your legs are permanently failing. For many people, it means the nerves have a lower tolerance for load, and how you manage that load matters. Once you understand that, the focus shifts away from forcing strength and toward choosing treatments that actually reduce nerve stress and improve tolerance. This is important because not all treatments are helpful for this problem, and some well-meaning advice can actually make symptoms worse. Let's talk about which non-surgical treatments are commonly used for lumbar spinal stenosis and why the right approach makes such a big difference. Once you understand that the issue is nerve stress and load tolerance, treatments start to make more sense. The goal is not to force strength or push through symptoms. The goal is to reduce irritation to the nerves and improve how the spine handles load during walking and standing. One approach that's commonly used is chiropractic spinal adjustments. When applied appropriately, adjustments can help improve motion to stiff spinal joints and reduce uneven loading through the lower back. That can take pressure off irritated nerves and make walking and standing feel more comfortable. Adjustments are not about forcing bones into place. They're about restoring movement so the nervous system doesn't have to work as hard to protect itself. Another non-surgical option that is often discussed for lumbar stenosis is spinal decompression. This is a gentle, controlled form of traction that aims to reduce pressure within the spine and around the nerves. For some people with stenosis, decompression can help create temporary space and reduce nerve irritation, especially when symptoms are clearly worse with standing or walking. It's not appropriate for everybody, but when matched correctly, it can be a useful part of care. It's important to understand that neither adjustments or decompression work in isolation. They can help calm the nervous system and reduce stress on the nerves, but they do not work by themselves to teach the body how to tolerate walking and standing again. This is where the third piece comes in: exercises. In a moment, I'm going to show you two specific exercises we use to help people whose legs feel heavy or unreliable. One is used to calm irritated nerves, the other is used to carefully rebuild walking and standing tolerance, so improvements actually hold instead of disappearing. These exercises are used to gently unload the nerves, improve how the spine moves during daily activity, and slowly rebuild tolerance for standing and walking. They're not about building strength or standing straighter. They're about retraining your nervous system so it doesn't shut your legs down when you're upright. When these exercises are done at the right time, they help make the improvements from adjustments and decompression last, instead of symptoms returning as soon as you try to be active again. The first exercise is called supported flexion breathing. This exercise is chosen to calm the nerve irritation. We use this because it gently unloads the nerves in the lower back and helps reduce irritation without stretching or forcing movement. You can do this exercise in the morning if your legs feel stiff or heavy when you first get up. You can also do it in the evening if walking or standing during the day has increased your symptoms. It's especially helpful after activity when your legs feel tired or unreliable. To do this, sit in a chair with your feet flat on the floor. Gently lean forward and rest your elbows on your thighs, or rest your chest and arms on a pillow or on the arm of a couch. Let your back relax. You can do this at home, at work, or even in a quiet public place if needed. Take slow, steady breaths in through your nose and out through your mouth for 1 to 2 minutes. You're not trying to stretch or push anything. You're giving the nerves a break. If your legs feel lighter, steadier, or calmer afterward, that's a good sign. If symptoms increase, you should stop. This exercise is meant to reduce symptoms, not work through them. Many people also use this exercise during walks. If your legs start to feel heavy, you can stop, lean forward into a railing, a counter, or even a shopping cart, and take a few slow breaths before continuing. That uses the same principle, and it helps you walk further without forcing it. The second exercise is called interval walking tolerance training. This exercise is chosen to rebuild the tolerance for walking or standing without triggering that shutdown response. We use this because it teaches the nervous system that walking is safe again without pushing it past its limit. Start by walking as far as you comfortably can before symptoms increase. Stop before your legs feel heavy or unreliable. Rest by sitting or leaning forward until symptoms settle. Repeat this for several short rounds instead of one long walk. Over time, the walking intervals should slowly increase. Rest is part of the exercise, not failure. These exercises are not used while the nerves are flared up. They work best after nerve irritation has been reduced, because that's when your body can move without constantly triggering symptoms. Chiropractic adjustments and spinal decompression help lower stress on the nerves. Once that stress is reduced, the exercises are used to slowly rebuild tolerance for walking and standing. This step is what helps prevent symptoms from coming back as soon as you try to be more active again. When these pieces are used in the right order and at the right intensity, many people feel more confident walking and standing without feeling like their legs are about to give out. You now know why your legs can feel heavy or unreliable when you walk or stand, and how that is often related to nerve load rather than muscle weakness. You also learned how non-surgical treatments like chiropractic care and spinal decompression are commonly used to reduce nerve stress and why they work best when matched correctly. On top of that, you have 2 targeted exercises you can use to calm irritated nerves and rebuild walking and standing tolerance the right way. If you found value in this video, please like it and share it with someone who might be dealing with similar symptoms. Also, drop a comment below and tell me what you've been dealing with, especially if you've been struggling with leg weakness or spinal stenosis. And remember to subscribe if you want more simple exercises and proven tips to help you feel better, move better, and stay pain-free. If your leg weakness is also associated with sciatica or nerve pain running down your leg, then watch this video next, where I walk you through 5 gentle daily movements to help relieve nerve pain down the leg. Go watch that video next.